So we made a very intentional and somewhat risky decision to move our youth conference all online. We were nervous. It was a little daunting. Our team has been great though.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
This is the Mid-America PTTC podcast. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. And today we'll be talking with Chrissy Mayer from DCCCA in Kansas. She's the Chief Community-Based Services Officer and has over 20 years of experience serving the prevention field, providing training in TA, and leading her team across the state. In today's episode, we'll be talking about how Chrissy and her team have adapted to the new virtual working environment. They transitioned an entire youth conference to a new virtual format and even launched a weekly virtual prevention training series. Her team has been innovative and courageous as they jump into this new territory. So we invite you to listen along and hear about their inspiring work. Before we get into the content, we'd like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's episode. All right, I would like to welcome Chrissy to the podcast. Chrissy, thanks for joining us.
Thanks, Dave. I appreciate you having me.
Yes, hey, we are very appreciative and thankful that you're taking time out to join us. I know everybody is crazy busy right now, adjusting and remaneuvering their work plans and supporting their teams. So thank you. We greatly appreciate it. But for those listeners that aren't familiar with you or DCCCA, would you mind just sharing a little bit about your background and what DCCCA is?
Sure, I'd be glad to. So my name's Chrissy Mayer, and I'm the Chief Community-Based Services Officer at DCCCA. So basically what that means is I'm in charge of all our community programs, including prevention, or traffic safety programs. DCCCA is a nonprofit social service agency. We were founded in 1974 as kind of a grassroots organization focused strictly on helping folks recover from alcoholism. But after a couple of years, we realized we could do a whole lot more. And so our scope moved to a statewide scope. And now we have 13 locations in Kansas, Oklahoma, and Missouri, doing a variety of services, prevention work, traffic safety work. We support foster families. We do residential and outpatient treatment. And then we also have a quality improvement and research division as well. We also do a fair amount of family preservation work in the Kansas City and Wichita regions as well. So lots of just general social service work, but my division is really focused on those community-based projects. I've been with DCCCA for about 20 years, actually just over 20 years now. So I've gotten to see the prevention field evolve significantly in that time. And it's been exciting to watch it grow and change, especially now. How things are changing as well. We're in a whole new learning curve for sure.
Y'all have a lot going on there. Some great things happening in Kansas. And so the community-based side, those community projects, what sort of services or support do you guys provide?
Sure. So our main role is providing training and technical assistance to community coalitions in Kansas. We have a little over 75 coalitions that we provide training and support to. Some of those are funded by our Kansas Department for Aging and Disability Services. Other coalitions have some local funding. Others are funded through DFC. Others don't have funding at all. And so we really run the gamut of how we support them. Our model, we definitely stick to the strategic prevention framework and work diligently to guide coalitions through that process so they can be successful in their planning efforts. We work closely with our partners at Wichita State University Community Engagement Institute, the University of Kansas, and also Greenbush to support these coalitions and do this work. We also have a large prescription drug prevention project. We provide a lot of training and support around opioids, both in Kansas and then also in Oklahoma County, Oklahoma. So kind of a wide variety, but really our bread and butter is the training and TA area. We've done that for many years and have definitely refined our approach to that so communities can be successful.
Training and TA sounds a lot like what we do at the PTTC. Bet y'all have been kind of remaneuvering lately. I know we have, adapting to the new work from home, work remote, can't meet in person environment. How's that been going for y'all?
It's definitely a transition. We have been kind of in this at-home remote working environment for about a month, and we've definitely got some lessons from that. Our team has really a great job stepping up and coming up with new innovations and new ideas for service delivery. Prevention work still remains and still needs to continue, even in the face of a pandemic. Issues that communities had before don't automatically just go because another crisis evolves. And often this is the best time to start talking about what are those protective factors that we can put in play to really support communities, because it's a stressful time. Community members are stressed, families are stressed. So what are those protective factors we can reinforce? What are supports we can put in play? And we've really just been creative in how we deliver our services. Also being empathetic to communities. Sometimes they're not ready for the services we provide. And so we just need to be patient and wait for the right time to share the sources, but just letting them know that we are there to support their efforts. And that work has definitely looked a lot different over the past month. We have our work to a virtual platform. So the team has had lots of challenges learning the technology to go along with the resources and support, and also helping the coalitions deal with the technology challenge as well. In some of our more rural parts of the state, connectivity is a challenge. So we've been trying to identify ways that we can maneuver around that and still provide our training and support to them as well. We do have an obligation to support the community, do the best we can with that. So we've definitely been open to feedback and have just been really intentional about reaching out to our coalition partners to identify what they need and how to support them.
Got that service-oriented mindset and heart set. Y'all do care. You really do. And I like how you said, you've got an obligation to the communities, and those prevention needs aren't going away. They're still there. And so you guys are working to innovate and adapt to meet those needs. Now, I can only imagine, though, just sort of thinking to the leadership aspect, when you're going to lead a team through change, it can be kind of scary. It can be challenging. What was sort of making that transition like? How did that first conversation go? Any resistance?
There was a little initially. When this whole thing kind of started, we had no idea that it would grow to the scope it did. Initially, my department was one of those to send their staff home because we have the capability to really look anywhere our service is tied to it specifically. And so I asked, this week we're going to start working from home. And for the most part, folks were receptive to that. There were a few questions about, how do I navigate this meeting, or how do I do some of this? And a lot of those choices were kind of taken away from us just because things were canceled. Things were moving so quickly that we were trying to stay ahead of a couple of things. When coalitions started having meetings canceled, when the stay-at-home orders started coming into play, that's where we started to get a little pushback from coalitions. We were trying to adjust our training and outreach, and many of them were either involved in schools or health departments that were critical during this time. And they were on developing continuous learning plans, working on the public health response, and they didn't have time for prevention work. It dropped on the priority list, which absolutely makes sense. Sometimes our priorities need to shift. And so initially, our resources weren't really received well. So we kind of took it back, and as a team, I said, well, how can we still be innovative? Just because people are saying, no, we don't need this right now, what can we do different? And the team came up with the idea of training hour Thursdays. So every Thursday, we started April 2nd, and they'll run through June 11th. We're offering an hour of just community-based training. It's all offered through Zoom. We started with utilizing the SPIF process as kind of a foundation. We offered a training on assessment capacity. We had 45 people register for that training, and 30 actually showed up and stayed the whole time. So we were thrilled at that response. We weren't sure if people would come, and then we weren't sure if they'd hang around, because it's easy to click off of virtual training. But they came, they stayed, and they gave us really excellent feedback on things they want to see more of, things that are helpful to them. And so we got some really great feedback on that. For upcoming sessions, we have anywhere from 71, or actually 76, up to 76 people registered for those sessions, and just as few as 30 is our lowest number of registered people. So people are really responding to this training hour Thursday. They know it happens every week. And we record it as well, so there is an option for people to view it later if something comes up and they can't see it. Our community support specialists have been excellent about outreaching the community and sharing the information with them, and just encouraging them to attend. Again, pretty low commitment thing. It's an hour once a week. We've had success with that for sure.
That is just really cool. I like the concept that it's every Thursday. It's consistent. It's going to be there. If you're a community member, you don't have to think, oh gosh, when is that next webinar? I hope I don't miss it. You all are reliable and consistent, and you're there for them when they need you.
Yeah, we're definitely trying to be consistent anyway. There's so much consistency right now, and things are changing constantly. We're trying to be kind of a constant resource.
Constant resource, and y'all are there. You're always happy to help and support them. Now, I'm curious, with such a great response to the weekly trainings, have you found new folks that not your usual crew? Are you able to reach new populations, new groups with these?
We're hitting a whole new population of people we typically would not get. We've had some interesting response. While our trainings are targeted to Kansas residents, we've had attendees from California, Wyoming, Iowa, and South Dakota as well. So that's been really exciting to see, just the reach we're having. Prevention work's needed everywhere, so it's not exclusive to one state. And the information we're sharing is, SAMHSA, strategic prevention frame stuff, and that's consistent across the nations. Everyone's finding value in that for sure. And we've also just found new partners in Kansas that we typically wouldn't have engaged. We've had lots of community mental health center partners that we typically haven't engaged, youth serving organizations, some hospitals. So lots of different voices, and some unusual voices for sure, that will give us an opportunity when we can get back to some in-person support. We'll have a new network of people to begin connecting with to share the prevention message.
Speaking of getting back to in person, does that mean these weekly trainings will be going away?
This is one thing I think we're going to keep. This is something we probably wouldn't have done if we wouldn't be faced with a pandemic and if we wouldn't have been forced in this direction. But the team has been really innovative, thinking about, well, what are things that people have asked us for? And so in addition to the strategic framework, we're offering sessions on vaping, alcohol prevention, meth and opioids, just a wide variety of things. We're also looking at some suicide prevention as well. Just because in these times where people might be feeling isolated, if we can help people see what, signs and symptoms of, suicidal behavior might be, they could help a friend and save a life in that regard. So we're really trying to connect all these shared risk and protective factors between substance use and mental health, and making a comprehensive approach for this work. So I think we'll definitely keep these online trainings and develop them even further with some feedback from our community members.
I like it. Good. Although this is a regional podcast, we do get folks all across the country. So there might be some additional folks joining in on these weekly trainings. They are solid content. Now you'd mentioned being able to reach some new youth serving organizations. Kind of made me remember, you guys have a new spin on your youth conference. What's that all about?
We do. So we have been planning the Kansas Youth Community Change Conference, or KY3, for about 8 months. We'd been planning. It was scheduled for the end of May, an in-person 2-day youth-led event so we could empower youth leaders in prevention work in the state. Obviously, with the stay-at-home order, this has shifted things a lot. We were recognizing about 2 weeks ago, we decided we need to approach this differently. We don't know how long stay-at-home orders are going to last. We don't know how long social distancing will be in play. And even if social distancing restrictions were lifted by mid-May, we don't know if people would be comfortable bringing large groups of kids together in one space. So we made a very intentional and somewhat risky decision to move our youth conference all online. We were nervous. It was a little daunting. Our team has been great, though, at reaching out to speakers, telling them what we were thinking, and the speaker response has been amazing. We have partners from Youth to Youth International, the Kansas Attorney General's Office, the Kansas Leadership Center, a couple youth coalitions, Rise Up Reno, and then also Woodson County, Headquarters Counseling Center, lots and lots of partners who jumped on board immediately with us and said, yes, we are in this with you. We want to help and we want to do this. So we kicked it off virtually 2 weeks ago. We opened registration and we have over 208 people registered for this conference. About 80% of those are youth and the rest are adult sponsors. So we are really, really excited to see how this is evolving. The conference actually kicks off on April 20th and it runs through May 21st. The schedule of events can be found on our website, and we're just encouraging people to register, to click through our sessions, see what's interesting, and then join us for those sessions. The sessions will also be recorded and they'll be available on the DECA YouTube channel. So we're just really excited to see where this goes, and the youth response has been fabulous. We have students saying, I'm so excited to be able to do this. I wouldn't have been able to come otherwise. Again, we have youth from all over the state. And quite frankly, our capacity for a virtual training is greater than it would have been in person. So our reach is going to be so much better.
I was going to ask, how does the virtual numbers, how was that compared to what it would have been in person?
We would have only been able to take about 130 youth, plus about 40 speakers and sponsors. So our capacity would have been about 170. And like I said, we're already over 208. So our reach is so much better. And, depending on how it goes, again, it remains to be seen, what the feedback will be. But I think this is something we could evolve, into the future as well. Just because we're meeting kids where they're at. They're stuck at home right now. They're looking for something to do. And so we've tried really hard to select speakers that are interactive, that care about youth and want to empower them to be leaders in their community. So we're focusing on leadership development, substance use prevention, mental health promotion, communication, suicide prevention, all things that matter to students. And we're really trying to engage them as leaders in prevention work.
I'm excited to see how this goes next week, and I will be watching and following along. Sort of a logistics question. Say somebody listens to this podcast on April 23rd. It's like, oh, the conference has already started. Can they still get in on it and enjoy some of the sessions?
Absolutely. People can register at any time. The sessions will run through May 21st. So you can register anytime, and you'd be able to get back. Let's say you registered on April 23rd, but you wanted to see that session that was April 20th. You would then have access to those recorded sessions to be able to view those. So absolutely, we don't want a date to restrict anybody's participation.
All right. Well, then there will be a link to the registration in the show notes for this episode. Now, sort of getting back, I'm curious. As we've been putting together virtual services for the PTTC and are previously doing in-person services, just thinking what our logistics has been transitioning those in-person to virtual. Y'all, in a matter of a month, 2 weeks to a month, launched weekly virtual trainings and a youth conference. Any sort of lessons learned around what's worked or not worked, or some of the unique challenges to doing that? Because, man, y'all did that quick.
We went from 0 to 100, definitely. This is the great thing about the prevention team at DECA. They are willing to jump in and learn and help each other out. The technical side, I'll be real honest with you, I know nothing about how to run the technical pieces, but I don't have to because I have 12 other people who can and do that. So that's really wonderful. But they have been coordinating with each other and identifying, oh, if you do this in Zoom, you can't do this. So we've been learning about the webinar features versus the meeting features, utilization of breakout rooms and polls. I think our first kind of Thursday training hour, there were a few glitches, but now we're running smoothly. And we were just troubleshooting this morning about, okay, the youth conference, we're going to have 130 people in one session. What do we need to be thinking about so that we don't have glitches with technology or glitches with the rooms? What are the things we can do? And so we have a team now researching this and reaching out to the Zoom kind of technical support people just to make sure that we've done everything we can to make this go smoothly. I think the biggest kind of takeaway from this is we've had to be flexible with our approach. This work is very adaptive in nature. There are some technical components, but it's taken everyone to move this forward and to make it successful. So I think lessons learned, we've got to communicate with each other. I don't think there's such a thing as over communication at this point. We have had some challenges with overscheduling. And so we've navigated some of those and put processes into place to ensure that we're not scheduling on top of each other. So I think these are all things that have come together to make us successful in this regard.
That team approach. I like to say prevention is better together.
Yes, absolutely.
It is. So any other sort of unique challenges that you or the team have experienced working from home now?
The team really misses seeing people and being around people. We've been having weekly team check-ins just to see how people are doing. And the extroverts on our team they're withering a little bit. They need to be with people. And so we've been trying to be intentional about giving them opportunities to see people and be around people. And we've just been trying to be creative in that approach. And so the team has been really good about connecting with each other, providing supports and resources. And I just keep reminding them that this is not forever. We need to make the best of it as we can and develop new innovations during this time. But there will be a time again when we can be around people and see people again. And that'll be great. But now we need to learn how to support people virtually and also take care of ourselves during this process too. So just allowing some space during team meetings to kind of talk about, these are the things that are hard for me. These are the things I'm struggling with. I think people feel a little bit better once they connect with their teammates, talk about what their challenges are and get some feedback on that. So allowing that space, I think, has been helpful for the team.
Being intentional about creating a safe space to share and be vulnerable and connect with your teammates. Great stuff. Really is. It's really motivating and energizing to me to see you and your team leading through this time, through this change and transition. You're serving as a leader, your team, they're all serving as leaders. You all are coming together, and prevention is definitely better together. So I love what y'all are doing there in Kansas. I'm going to keep on bragging about you to everybody I talk to. This has been a great episode. So much just raw value and just lessons learned from doing it and trying it and getting out there and just experimenting. So thank you for sharing. Any sort of last final thoughts or anything else you'd really like to shout out or highlight? And of course, I'll have a link to the youth conference in the show notes for everyone.
Great. Thank you, Dave. I just really appreciate you allowing some time for us to get on and talk about what we're doing. I think we are doing things a little bit differently than other people are, and leading the way. I want to give a big shout out to my team. They've been so good about being innovative and not settling. And when I ask for more, they give more. And I couldn't be prouder to be a part of that group for sure. So, if people are interested in joining our training hour Thursdays, we'd welcome more folks to that too. And again, thank you for posting the link to our youth conference as well. We're really excited to get this started and get engaged with young people. So just thank you. I appreciate your time today.
Yes. All right. Well, thank you and keep up the great work.
Thank you. Will do.
That concludes this episode. Thank you all for not only taking time to listen, but for your continued work making our community safe, healthy, and drug-free. If you'd like to know what trainings we have coming up, check out our website at pttcnetwork.org. There you can subscribe to our monthly newsletter and get the latest, greatest delivered right to your inbox each month. And remember, prevention is better together. And together, we are stronger. Thanks for listening, and we'll catch you on the next episode.